Can everyone hear the sound okay? Maybe just give me a yes in the chat if you're hearing this so we know the audio's good. Good. Those of you that are in attendance, thank you, Amy. Yeah, let me know. If you are dancing, we know you hear it. Yeah, I was really like grooving earlier when I was in here by myself, getting a little hyper, as I tend to do. All right. So it is 1:03, so I think we'll go ahead and get started. I just want to welcome everybody. Let me get the music stopped here. One sec on that. Okay. Lots of screen practice, which just launched last month. We're so excited to have you here with us today. We're looking at about an hour and a half today, but if we can, we will absolutely wrap up early. We will definitely not go over time. We really respect and honor everyone's time that's with us today. We've all been using Zoom for a long time, but it's always nice to have some reminders. First reminder, remember that HomeRoom Network is an interactive experience. It's not a sit and listen webinar style. For sit and listen webinar style, we have our Ohio McKinney-Vento Community of Practice. So HomeRoom, we invite you to have your camera on, be prepared to unmute, use the chat. A lot of today is going to be grounded in discussion. So the more you're willing to share with us and communicate with us, the more we're going to get out of the session today. The PowerPoint we will put in the chat in just a second for you. It is ready and available on our website, so you do not have to wait for that. A lot of times in these sessions, we do use breakout rooms. We won't be using breakout rooms today. We're going to use the full room for discussion, and we will continually be putting handout materials in the chat for you. Again, slides from today. We've developed a guidebook to community of practice. We'll put that in the chat. We've developed calendars so you know when everything happens. We'll make sure that's in the chat for you. And lots of other handouts all about COHHIO Course to Home, so you can keep trying to kind of put together what this thing is all about. I know we spent a lot of time in our last session kind of rolling out COHHIO Course to Home to you. It's a lot of information to take in, so we're trying to get some stuff kind of written down and guides and resources for you, so this stuff kind of starts to make sense for you. So keep an eye on that. If you're having any audio issues, please just try logging in and logging back out, or switch over to your phone. You're more than welcome to send a private message to me in the chat and let me know if you're having any issues, and we'll make sure that the session is working as best we can for you. So with that, we'd love to know who all is here in the room today. So the first thing I want to invite everybody to do is just share your first and last name, your pronouns, your district, and what is one superpower you bring to student homelessness work. So let's automatically take off our cloak of nervousness and any feelings of anxiety we might be having, and step into this space of, I have something to offer. I have something to offer for students experiencing homelessness. I have something to offer for my district. I have something to offer for my community. I am here and present to work to prevent and end student homelessness in Ohio. For me, I think my superpower on my not so great days is keeping calm and managing chaos. On my super chill days, I think my superpower I bring to homelessness is having a never-ending imagination. I always have a million ideas. I'm never short on ideas. So why don't you share with us in the chat what your superpower is and what your district is. Again, my name is Lisa Brooks. I use she, her pronouns. I'm the Youth Initiative Director at the Coalition on Homelessness and Housing in Ohio. And the superpower I bring to student homelessness is a vast imagination. So take a minute in the chat. Let me know where you're at with that. Welcome Marcy from Springfield, and Melissa from Montgomery, Jill from Warren. Empathy and looking outside of the box. I like that. We're going to be doing a lot of that today. creative and collaborative. Yep. Hey, Brooklyn City Schools, glad to see you here. Patience from the ESC. We know the ESCs need that patience. They need that superpower, right? Bringing the team together for help, absolutely. Ability to collaborate, awesome. Compassion and understanding, flexibility, skills and emotional support, positive energy, judgment and humor, non-judgment and humor is what I meant there. Absolutely asking good questions and relationship building. These are all really, really good ones. Thank you so much. Keep sharing your superpowers as they evolve for you, because this is really the stuff we're going to be leaning in on when it comes to coordination and collaboration outside of our systems, right? Those are the things we have to bring to the table to get the work done. So what are we doing today? We're going to first talk about what the objectives of today's session are, so what you're going to get out of this. We're going to do a quick warm-up activity to make sure those creative juices are flowing as we get later into the afternoon. We're going to do some quick COHHIO Course to Home reminders so you remember all the good, helpful stuff that's available to you now through COHHIO Course to Home. And then we're going to really dig into the meat of the content. We're going to do a general overview of the homelessness system. That's a little bit of a catch-22 because the homelessness system is vast and complicated. So doing a general overview is kind of tough, but we're going to start to scratch the surface today, and we're going to use the many, many months into the future to dig into this deeper. So keep the course and keep the faith as you begin to learn these concepts. And then we'll dive into what does our role look like in school districts? What are the building blocks or the fundamentals or the foundation? I'm really leaning in on this building blocks concept for this session of system coordination. How do we get there? If our district's already doing it, how do we strengthen it, make it stronger, make sure that it's effective? We'll do a kind of a group check-in and check-out throughout this session. Then we'll do closing. And as always, I like to leave you with a lot of resources. So I put a lot of work into ensuring that you have a lot of really good evidence-based practice resources that are out there around coordinating with the homeless system when you're in the education space. So the slides look similar to other slides, but they're all brand new resources. So make sure you're checking them out. In addition, some of you were asking in the last session for scholarly articles or scholarly journals. So I've included a whole list of resources that are scholarly around this topic so that you have access to evidence-based information. So that's a lot of info on the agenda, but we're just going to get through it together. What are we going to walk out of here with? We're going to understand the basics of the homelessness system, right? A little bit about how it works, terminology, who some of our point people are, right? We're going to learn the benefits of system coordination. A lot of times we struggle because the system is not super accessible in a lot of ways. So we really need to know what those benefits are to keep us motivated and solution oriented, right? Then we're going to learn the action steps needed to establish or enhance our coordination with the homeless system. And then finally, like I said, lots and lots of resources to help you kind of along this path as you start to do this work. So that's what we're walking out of here with today. That's our goal. In order to reach that goal, I think it's important to make sure our brains are warmed up and thinking creatively and I'm already struggling, solution oriented, right? So those of you that work in the education space, that's most of you, right? We always need to be entering our learning with an open mind, a lack of distraction, an open mind, and coming from a creative place. So in the last session, we used a Jamboard. We're going to use a Jamboard just for our warm-up activity today. So I've just put the link in the chat to the Jamboard for you. What I want you to do is go ahead and open that up in a separate tab as I start to explain what our warm-up activity is going to be. And then I'll do a quick reminder of how we use the Jamboard. So if you're new to Jamboard, just sit tight. I'm going to walk you through how it works in just a second. So what we're going to do today to get our brains thinking creatively, bring our prefrontal cortex online and really be thinking strategically and in a solution-focused way is to I've sort of created this activity from borrowing it from some school districts up in Cuyahoga County and mashing it together with some of my own ideas. So what I think I want to do today for our Jamboard escape is take a moment and think about some of the things that you're really into right now. I know when we were in the green room before we got into this session, Aubrey was talking about how she's really been into working out since the pandemic. Some of us might be really into potato chips and Netflix since the pandemic. You never know what your thing is that you're into. But in this work that we do, we need to have those little escapes along the way, whether it's just a deep breath and walking outside for a second, whether it is working on a puzzle with your significant other in the evening, binging a Netflix show. What are those things that you do? What are you into right now? And what are those things that you do? That's what we're going to be putting on the Jamboard today. And so this is like the new age techie version of an old school collage, right? We're just going to kind of make this homeroom network collage together. So how are we going to do that? You're going to log into the Jamboard if you're not there already. I need to switch my screen to Jamboard so I can see who's in there and who's not in there. And then, sorry, I just moved a lot of screens. And I'm gonna make sure you know how to use all the tools. So give me just 1 second as I flip over. Yeah, I see people are putting stickies on there. I see people using the Post-it notes. Perfect. So here's our Jamboard. Let me make it just a little bit bigger. Zoom's always taking up a lot of real estate on my screen. There we go. So this is how Jamboard works. Just as a reminder, you're just in Google. This is your normal URL browser up here, right? And then as you come down, you can see our Homeroom Network Session 2. That's the name of our board. We can flip between boards by the arrows at the top. Our toolbar is over here. Just take a second and mute if you're unmuted right now. You can use your sticky note to throw a sticky note on. You can use the pen. You can use images. And today we're really going to be focused on those images. So once you've had a second to test out these tools, I want to show you specifically how to use the Google Images. So maybe I should say it before I start clicking. So on your toolbar right here, the one with the little mountains, you can grab that, go to Google Image Search, and what's one of the things that I'm doing right now, that I'm really into right now, is probably watching Golden Girls until I fall asleep. So I'm going to search Golden Girls, and there's a little image that I like. I am going to put that on the Jamboard. Somebody put reading, so we're already kind of getting it, right? So find an image, test out this image feature, and then we'll go ahead and start working on our collage. To switch over to our collage, we're just going to arrow over and go to the next slide and start putting some images on there. So if you've got this down, I would totally invite you to switch over to the next slide and start populating this with some images. Oh, sorry, I didn't realize I was on mute. I was just getting really excited that somebody shared Ted Lasso, because I absolutely love Ted Lasso, and I cannot wait for there to be another season of Ted Lasso. So I share that with you. It looks like others are liking that too. Ami and Aubrey like it too. Someone's into kittens, and I can dig that as well. All right, well, I appreciate everyone participating in a bit of a warm up here and kind of getting our brains going. Please, if you're still thinking or trying to find the right image, keep taking some time and putting that stuff in the Jamboard. I will consolidate all this and put it into the work that we're doing as Homeroom. I think this is one of the many ways we can sort of get to know each other through this work. So thank you so much for participating in that with us as we kind of grow together as a group. So let me switch back over here. Can everybody see my slides fully? Okay. Make sure I'm not in presenter mode. All right, cool. So appreciate that. Hopefully everyone's kind of thinking in a gentle way now, thinking about things that work for them, right? Thinking about the things that we enjoy, the things that bring us peace and comfort, and things that are kind of uniquely ours, right? That's the way we need our brains to be thinking today. So as we start to ease in to our kind of learning objectives for today, let's go over a couple of reminders so we're all sort of approaching this work from the same space. COHHIO is facilitating COHHIO Course to Home and the HomeRoom Network for you, right? The last time we met, we talked about COHHIO. Our mission as an organization is a coalition of organizations and individuals committed to ending homelessness and to promoting decent, safe, fair, affordable housing for all, with a focus on assisting low-income and special needs populations. And we do this in a myriad of ways, which is sort of displayed by those little bubbles that you can see in the infographic there. Our youth work, our training and technical assistance, our advocacy, our housing info line. We do a lot of things sort of to that end around our mission. And we are sort of charged with leading this effort of supporting you in your work through COHHIO Course to Home and the HomeRoom Network. And definitely just want to encourage you to check out the COHHIO website. Right now, going on in another Zoom, in another sphere, is the annual Housing Ohio Conference. We have that every year. It's a great opportunity for folks to learn more. So that is just sort of the tip of the iceberg in terms of what COHHIO has to offer for school districts, in addition to COHHIO Course to Home. So a lot of folks make up COHHIO, but this is your unique COHHIO Course to Home team, your lead people in supporting your district and all the work that you do for students at risk of or experiencing homelessness. For those of you that have been with us during other sessions, you've gotten to know us. Those of you that are joining us for the first time, you're kind of getting to know us today. If you have met us before, you haven't met our newest member. So I'm going to go through and just introduce the full team and make some introductions of people who are with us today and experts in this work. And so I've already sort of introduced myself. Again, Lisa Brooks, I use she, her pronouns, and I'm the Youth Housing Initiative Director at COHHIO and leading the work of COHHIO Course to Home. And with that, I'm going to pass it over to my friend and colleague, Ami, and then Deanna, and then Evelyn all sort of introduce themselves to you.
Thank you, Lisa. Hello and welcome, everyone. My name is Ami Diallo, and I'm the Youth Housing Initiative Specialist here at COHHIO. I come from the adult education space, and one of my roles here at COHHIO is to help and support you by providing training and technical assistance to support you, your students, so you can support your student and families experiencing homelessness. And now I'm going to pass it to our amazing social worker, Deanna.
Hi, everybody. My name is Deanna, and I am the MSW intern on this project. And I do a lot of the background work. I do a lot of note taking. I do a lot of supportive work, anything really that needs done, and I'm happy to do it. And I am an MSW student at Ohio State currently, and I'm graduating here in a few weeks. So that's exciting, but I'm happy to be here with you guys. Oh, and I'm passing it off to Evelyn. Sorry, Evelyn.
No worries. Hi, everyone. I'm Evelyn Guerin. Like Ami, I am a Youth Housing Initiative Specialist, so I will be responsible for developing and delivering these trainings and also providing any technical assistance you might need. I just joined the COHHIO team on April 1st, so I am still transitioning into this role, so you probably won't be hearing too much from me today. But as you continue to show up to these sessions, you will definitely be hearing from me more in the future. And with that, I will pass it back to Lisa.
Thanks, Evelyn. Good job, everybody, getting to know the team. Evelyn's first session. This is exciting. Before I introduce our guest experts, community collaborators, I just want to quickly nod to our ODE friends that are in the room. Susanna Whalen is here from Ohio Department of Education. She just wants to wave and say hi. And then Betsy's also here from ODE, who can just wave and say hi or say hi in the chat. These guys at the department are super motivated by all the hard work that you're doing, and they are here to support you and learn about your district. This is a time for growth and development for all of us, so we're really excited to have them here from ODE. All right, and with that, I'm even more excited to announce that Aubrey, who was able to make her way from our conference into our session today, and also Karen, who's always there for me at the drop of a hat, who really came through to provide some expertise to this session today. So I really want to, it's a great honor and a privilege to introduce to you Karen McHenry from Belfair's Homeless and Missing Youth Program up in Cuyahoga County, who is a expert outreach leader and team lead at Belfair, joining us today, and also Aubrey, who works with a lot of youth programs and does a lot of training and technical assistance and helped lead the YHDP effort in Franklin County, who are both here today. So Karen, I just want to start with you. You can introduce yourself, tell folks a little bit more about Belfair and what your superpower is that you bring to homeless work that you do.
Well, good afternoon, everybody. I'm excited to be here. Yeah, Belfair is a very large child welfare agency. So, we have a whole continuum of care ourselves, but we work very closely with our homeless and missing youth programs. We go up to age 21. And since the pandemic, it's really changed and evolved just how we can stay in contact with people, making sure we're getting these students to school. Many of them have not returned to school. School used to always be a really safe place, and it still is, but many of our students have not returned to school. So, I think I said my superpower was like crisis work, but also it's just like, when I think about it, just like speed. People laugh, but we are just running from one thing to the next. That's like the downfall of Zoom, is that people think you're just gonna be able to meet back to back. So I feel like we've all just been in this overload pace for a really long time, and it makes it challenging. So I'm excited to be here. We work so closely with schools and all the McKinsey-Vento liaisons, and I'm just excited to be here. So thanks for pulling this together, Lisa.
Absolutely. Thanks for sharing your superpower of speed and keeping up with us as I contribute to that overload sometimes. I'm super appreciative. And with that, Aubrey, let us know who you are, what's going on at CSB, and the superpower that you bring to student homelessness.
Thank you, Lisa. I'm Aubrey Jones. I'm the Outreach and Youth System Manager for Community Shelter Board. So I oversee the YHDP services. We have a little bit over $3 million in funding locally to work on youth homelessness for mostly 18 to 24-year-olds, although we definitely see some minors in our system. But yeah, so I come from a youth background, and I'm so excited to be here. Definitely youth and students is my jam. I am very dedicated to supporting our partners in the community. I work with the YMCA, Huckleberry House, and Home for Families locally to work on youth homelessness. So I'm glad to be here today. Thank you, Lisa.
Thank you so much, Aubrey and Karen. I put the website for Belfair JCB in the chat, and also the website for Franklin County Community Shelter Board, kind of flagged the youth-specific work that they're doing in the chat for you. And those links are also available on the resource slide. So if you're like, wait, what organization did they say? Wait, what do they do? Wait, how do I get connected to them? Their websites are in the chat. We'll make sure you have their contact information, and we are really excited to have them with us today as we walk through this work. So we always want to show up to Community of Practice with intention and stick with the agreements that we've established as a Homeroom Network community. So we're going to always revisit these, but we spent a lot of time on them last month, and it feels like we just turned around and we're right back in this room. So we're not going to belabor these, but we're just going to touch on them really quickly and make sure that we're all still kind of on the same page with the agreements. As always, uplift anything that's important to you around our Community of Practice agreements in the chat. First and foremost, we check in and we check out. Sometimes this information doesn't feel relevant to us. It's all about taking what you need and leaving the rest, right? Sometimes we're super engaged and it's all resonating with us. Sometimes there's just too much on our plate to be able to take that in. So we check in and we check out, and we have grace and forgiveness and support for each other as we work through our learning as an individual in this space. We listen for understanding, and kind of explains itself, but we're not making assumptions, right? We're here to listen and we're here to learn. We expect and accept non-resolution. And for those of us that work in the homeless space, this is something we're doing all day, every day. It doesn't usually end up the way we want it to. It's all about how we show up and work towards a shared goal, even though it might not look the same as how we thought it would when we first started, right? I was just having a conversation with an ESD lead about that yesterday during networking, so it feels even more relevant. We practice both and thinking as opposed to either or thinking. Both things can be true, right? It's not right or wrong. It is what it is. It's not black or white. It's very, very gray, right? It's sort of that both and thinking. We're aware of our intent and our impact. We understand that we may not say something with not the right intention. That doesn't mean that it won't have an impact, right? So the way that we set our intentions and the way that those intentions impact others are something that we hold as a value in this space. We make space, we take space. In this particular Community of Practice, we're very, very interactive. So it's really important for you as a person who may sit back sometimes and be more of a listener. I really, really, really want you to call on your courage and your vulnerability and your willingness to come off mute and share, to put things in the chat, to ask questions, to say what you need to say so that you can be heard and supported in this space, because what's going on in your district really matters to us. For those of you that are like me and you sometimes struggle to zip it and you talk a lot, I get it because I'm one of you, right? But this is a shared learning experience. So sometimes we need to step back, be okay with a few moments of awkward silence, and allow others to take up space, right? And then finally, I said I wasn't going to belabor these, so I'm trying to keep it moving. Elmo is a safe term that we have. Enough, let's move on. And ouch. That's really helpful on that intent versus impact, and we don't have to belabor what's going on, but we can make it be known that that impacted us in a way that created some discomfort. And that's how we respect each other in this space, and these are the agreements that we kind of use to coexist. I'm going to have Evelyn, if you wouldn't mind, just sharing again the Community of Practice, the guide to Community of Practice in the chat. Just so folks have this, it goes more in depth on what our principles and our agreements are. I think I just want to touch on a couple of these. We won't go through all of them. The first one is just crucial to the conversation today and all the conversations we will have. We recognize that all communities and districts are unique. Invisible period there. But, and have some shared challenges and can learn from each other's experiences. So yes, your district matters. It is unique. It does not work the same as every other district. But there are things within your district that can be shared with other districts, and we can all learn from each other. So we respect that uniqueness, we honor that uniqueness, we need that uniqueness in Ohio to be successful, but we also have an agreement that we work together to learn things. We ensure strategies and approaches are embedded in equity, including racial and LGBTQ equity. And again, I'm not going to touch on all these. I just want to also underscore again that we are solution-oriented and creative in our planning and problem solving. We do not show up with hidden agendas. We do not show up with challenges without ideas, right? We are coming to this table with ideas and to work together and to be solution-oriented. Definitely in the chat, please share any other principles that are important to you to uphold in this space. And if this is something that you want to better understand, I would absolutely encourage you to please review our guide to Community of Practice. which also sort of helps you to think through how you show up in this space and how you can get the most out of this space for your district. Oh, let's do a collective transition here into our homelessness concept, right? So a couple other quick reminders about COHHIO Course to Home. Don't forget to check out our website. If you haven't been there in a couple of weeks, man, we've done a lot. So there is a lot of new information on the website, so make sure you're checking the website out. Evelyn will also put in the chat the calendar for Community of Practice. We have 2022 all the way to 2024 outlined for you, so you can start putting these sessions on your calendar now, and you can kind of plan ahead. So that's coming down the road. And don't forget that in addition to HomeRoom Network, we also have the Ohio McKinney-Vento Community of Practice quarterly. We will have a session coming up on May 18th, specifically on rural student homelessness. So lots more to come. And again, don't forget, we're here for technical assistance. If you need technical assistance, just reach out to us. We've also developed a guide for that, and we'll put that in the chat for you as well. I don't want to hammer reminders that people already know, but I do just want to make sure that folks do know them. So with that, we'll start to transition out of COHHIO Course to Home talk and start to really focus in on the homeless system and how we show up as collaborators. So I was really thinking about the homeless system. It's a system I've worked in for a long time. It's a system I experienced as a young person and a student. Having lived experience of homelessness in rural Ohio, it's something that's always sort of on my mind as a system, right? The education system is a system. The homeless system is a system. The healthcare system is a system. The transportation system is a system. We have many systems, right? We're all kind of cut from the same cloth, but we operate in our own ways. We have our own language, we have our own leadership, we have our own kind of ways of steering and working the world. And so when I think about the homeless system and the education system, I've been thinking about them as two kind of separate brick roads. They're made up, again, they're kind of cut from the same cloth. They're both made up of bricks. But the way that those bricks are positioned and the way that they come together doesn't always look the same, right? It's like we're operating in the same kind of space, but it looks and feels different. We have different definitions. We have different leadership. We have different terminology. We have different ways of going about the work. And so as we kind of plow through this content today, we're going to think about what the building blocks to bringing those roads kind of together is. And we're going to kind of, hopefully not too cheesy, sort of use this analogy to think through how we can kind of restructure, reorganize, repurpose, and be intentional about the way that we make this happen. So I want to start us off with a quote. I did a lot of digging into the origin of this quote, and I learned a lot about the origin of this quote. I won't go into that here, but if anyone's interested, definitely hit me up because there's a lot to this particular quote. So if you want to go fast, go alone, but if you want to go far, go together, right? That's what we're working on today. How do we go far together? So first we have to kind of have this common understanding. Defining homelessness. Newsflash, McKinney-Vento has been around since the 80s. However, whenever we have federal legislation that doesn't have a ton of buy-in, it's like writing a law that no one agrees with. It's hard to enact, right? And then when we have legislation that no money is put with, that is what we call at COHHIO an unfunded mandate. So now we sort of have this law that we didn't do a lot of work to get buy-in on, and we have this law that we didn't put any money with. So then when you say to somebody, as a McKinney-Vento expert, as many of you are, you know about the McKinney-Vento Act, and they're looking at you like you're speaking another language, and you're frustrated because it's been around since the 80s. This is why, right? When the federal government rolls out a rule and doesn't do adequate education or support and certainly doesn't put any funding with that rule, it becomes sort of a hidden crack, right? It becomes a hidden thing that turns into a crack. And what happens? The cracks, things fall in and things get lost. And so when we think about McKinney-Vento law, it's important to kind of have that history of how we got to that act in our mind. And then it's also important to acknowledge where we are in 2022. With the CARES Act, the pandemic, American Rescue Plan, I kind of flipped that narrative that I just said on its head, because we've taken funds and attached them to this mandate at this point, right? So what has once been an unfunded mandate, now there are actual dollars to support the work. So there's always been a little bit of money, but not much. And so when you have hundreds and hundreds and hundreds of school districts in Ohio, all of which have students experiencing homelessness at different levels. We really need to have adequate resources to address this law. And so one of the beautiful things of the American Rescue Plan is we have some additional funds that, unlike anything we've ever seen before, I'm not going to use that unprecedented buzzword. I'm just going to say, unlike anything we've seen before, to kind of move this work forward. So most of us are aware, we know that McKinney-Vento law says that homelessness includes individuals who do not have a fixed, regular, and adequate home because they have lost their home. And then we sort of have examples here of what that looks like in a McKinney-Vento space. So during registration, we asked you all to kind of work with us and help us understand what you know about the many definitions of homelessness. So we know we've got the McKinney-Vento definition. Our McKinney-Vento liaisons in school districts are working through eligibility every day to determine when students are experiencing McKinney-Vento homelessness. But what about these other definitions of homelessness? We've got a HUD definition of homelessness, housing and urban development, and we've also got a health and human services definition of homelessness. So you might remember when you registered for this, either 30 seconds before it started or a month ago when you started getting the invite, that we wanted to know, what do you know about the definition of the HUD definition of homelessness? And so most of you, about 77%, are aware of the HUD definition. Some of you are not. So we think it's important to make sure that we touch on that as we work through this kind of introduction to what the homeless system is. So unlike McKinney-Vento, which is looking at no fixed, regular, adequate residence, HUD, let's just say we've added some significant layers of complication to determining what homelessness is and looking at each individual experience. And so this definition is so long that it actually has to take up 2 slides. So that gives us, and this is shortened, so it's not even the full textbook, right? And so being a master of the HUD definition takes a long time. And I don't know if anyone is ever truly a master, even HUD. And so this is not something that we're going to grasp immediately, but it's something that we have to take on if we truly want to be partners in the work to prevent and end homelessness. Because HUD is the biggest funder of homelessness services. So their definition does matter, even if we don't agree with it. I don't think whether we agree with it really matters when it comes to system collaboration. It's more about knowing it or not knowing it. So when you think about the HUD homeless definition and you think about homelessness generally, you should think about the homeless system kind of like you think about an emergency room. The homeless system is intended for immediate crisis, homeless now, already unsheltered, already experiencing homelessness, or within days of experiencing homelessness. Now, certainly, we have students within our districts that fall under this category. We certainly have students living in places not meant for habitation. We certainly have students who are right on the brink of experiencing homelessness. If we back up a little bit, though, we also know that we have families and unaccompanied students who are doubled up, who are looking at a longer period of time before they're going to kind of be at that emergency room level of homelessness. So let's just kind of hold those ideas in our head as we start to work through this content of thinking about how the homeless system truly responds to homelessness and what that looks like when we kind of set it next to the education system. So another kind of important question that we asked you that I wanted everyone to sort of see where we stand. In addition to the homeless system, we sort of have the housing system. And I know some of you work with housing authorities. And so I was curious how many districts that are registered for this session work with your local housing authority, and about 60% said yes, and about 40% said no. Does your district work with the local continuum of care? About 36% of you said yes, about 54 or 55% said no, and about 9% were not sure. So I want you to know that we are listening to your feedback and trying to hear where you're at and bring you information that speaks to what you're telling us. And I think it's important for you to kind of see where your peers are at for us to truly be a community of practice. This is sort of where our peers are at. So let's dive into a COC. What is a COC? What is a continuum of care? How does that work in Ohio? So we look at Ohio, we are made up of a balance of state as well as many continuums of care. So we have 9 total continuums of care. 1 is the balance of state. The other 8 are urban COCs. So when you look at Ohio, if you're in an urban community, You've got Franklin County here, which is blue, right? That's an urban COC, urban continuum of care. Stark County, Mahoning County, Summit County, Cuyahoga up here in Lucas, Montgomery. So maybe, I think a lot of you did this when you introduced yourself, but I want you to think about it in a new way. Let's see if we're grasping this. Where is your COC? Can you tell me in the chat which COC is your COC? Are you a Franklin County COC? Are you a Balance of State COC? If we don't know, you can say don't know, because we can spend more time on this depending on whether people can identify where they're at. Okay, Summit County COC, Montgomery COC, Balance of State, great. Cuyahoga, Balance of State. Yeah, keep letting me know, Balance of State, great, great. Okay, so why does this matter? Well, when we're talking about the HUD definition and we're talking about continuums of care, continuums of care are charged by HUD and many other state departments to create a continuum of services that prevent and end homelessness, and is also really kind of this epicenter of receiving funds directly from the federal government. So in urban communities like Franklin County or Columbus, Lucas County or Toledo, your communities receive your funds directly from HUD. If you are in the Balance of State, you are in the 80 rural or suburban counties that make up the Balance of State continuum of care. And so HUD allocates those funds directly to the Balance of State COC, and then the Balance of State COC kind of reallocates those funds out to your community. So this first map makes it real simple. It's kind of like, here's all the COCs. For those of you that are in the Balance of State, it's important for you to understand how the Balance of State works, because it's a little bit more complicated, a little less straightforward. In the Balance of State, we're talking about 80 counties, not just one. So in the Balance of State, we have 16 regions that make up those 80 counties. So you may already know that. If you already know what region you're in, go ahead and put that in the chat. If you don't know, look at this map, because you can kind of see, it's not great because there's so many and the color's not awesome, but I can help you kind of understand where you fall on this map. But you're within one of these Balance of State COC regions. So me, I'm down in Athens, I'm down here, region 17, right? One of the bigger regions within the Balance of State. So think about where your region is in the Balance of State, and that will help you to identify what COC you connect with and who your COC lead is. We're going to keep moving for the sake of time. We asked you, are you familiar with the coordinated entry system? This is the next really critical component of how your COC works. About 70% of you said no, and the rest said yes. So we do need to spend a little time ensuring that everybody kind of understands coordinated entry. And this is where I'm going to kind of dive into that whole idea of the homeless system is sort of like an emergency room at a hospital, right? And what is our role when we're operating in a system that's kind of like that? So what I like about this infographic is you can kind of see here, primary prevention. This is where we're really trying to prevent somebody from experiencing homelessness. But then once we've attempted prevention at the first stage and that wasn't possible, what we look at here is identification. So we can see the schools are a primary identifier for people experiencing homelessness. They're not the only identifier, but they're a primary identifier. So child welfare, juvenile justice, and other systems are also identifiers of people experiencing homelessness. And then schools can make a direct referral to the coordinated entry system, which we'll get into here in just a second. And the intention of that system is to prioritize and connect families that are referred with direct assistance. So that family may need to be in shelter or transitional housing for a period of time, but the ultimate goal is to prioritize them and ensure that they receive permanent housing. And as you can see, the school kind of pops up over here as well, because once a family has achieved permanent housing, we never want the school to go anywhere. We still want that school connected to the family in their permanent housing, still providing all the supports that a family needs to maintain that housing and maintain that educational stability. So let's go one layer deeper here. We're looking at how systems operate within the coordinated entry system. And now, if you can kind of envision that other infographic with this infographic kind of on top of it, this is sort of what that looks like in real time. So a household needs assistance. They can walk in. I know up in Cuyahoga County, they have a little more of an in-person coordinated response that's been adjusted a little for COVID, but some communities do direct person walk-ins and some communities do hotlines. So it's important to know what your community does. Is it something where a person needs to respond in person, or is it something where they can call a hotline? Most of the communities in Ohio operate hotlines, but some do operate on the walk-in basis, so it's important to know that. Then the coordinated entry system will do what's called a vulnerability assessment, and then they'll place them on a shelter list or referral list for permanent housing. What's really, really, really important for schools, let's see if I can, I've never tried this, let's see if I can do this, is this part. Oh, can you see me circling this? Okay, cool. I've never really done that before, but it's working. This part is a really critical role that schools play. So if we go back to that idea of emergency room, anytime we can not go to the emergency room and see our primary care doctor or a different doctor, as opposed to spending all that time, energy, and money on the emergency room, we're going to want to do that, right? Coordinated entry works the same way, and schools play a really critical role in preventing the need for further assistance through the homeless system. So anytime we can divert, we want to divert, okay? That is a critical component of what schools can do, and it's something that you're going to notice. Oh, now I'm not sure if I know how to turn it off. You're going to notice is something that your partners are going to be pushing on you to do. Just like showing up at the emergency room, they'll leave you waiting in the waiting room if they don't see it as a critical need right now, right? So when we think about it like that, it's easy to kind of understand why in the homeless system perspective, they're prioritizing a person sleeping in their car. They're prioritizing a veteran that's been experiencing homelessness for 15 months, 21 months living on the land. So understanding how your students and your families fit into that dynamic is really important to understanding how to use the coordinated entry system. So now I've kind of, here we go. I thought I wasn't going to be able to click because I used that little, there we go. Sorry guys, I got a little overexcited by the annotate. So this is a little overwhelming. It's a lot of information if it's new to you. So one of the most important things I want you to know is where to find your access points, because that's really the starting place, is knowing how to access that hotline or knowing where that walk-in location is. So please, 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 this link is in the slides. We'll take you to the access point map for Ohio, and you can find the access point in your continuum of care using this map 365, 24/7, always available to you. So sometimes that first step is just knowing where the hotline is and who to kind of identify in your community as an access point. And don't worry, we will spend a lot more time over the next 2 years of really understanding the homeless system. We're just kind of scratching the surface today. I borrowed this slide from Aubrey because I really like it. And when we're thinking about diversion, well, what do we mean by that, Lisa? We need this family to get into shelter. We need them to get into permanent housing. We don't know how to divert them, right? We don't know what we can do. That's why we're calling you. And so I'm trying to help you understand that it's a give and take, right? We can't force people into a crowded hospital. We have to find ways. We have to create ways where they don't exist, and we have to get really creative. So sometimes when we're looking at diversion, that might be working really hard to identify if there's somebody else in the family they can stay with. And the cool thing about being a McKinney-Vento grantee or an ARP grantee is that you have some flexible resources around transportation. You can work with families to get diverted to a safe place to stay within the confines of your payment source, right? You can link them with financial assistance to meet those crisis needs if food is the issue, if clothing is the issue, right? You have some resources to address those things. Also supporting those people who are doubled up in making that a comfortable place to be in the short term, right? We don't want to assume just because somebody is doubled up, yes, they meet the definition of McKinney-Vento, but do they immediately need to be peeled out of there and referred to a shelter? Maybe not. So it's really important to look at what are the dynamics of that doubled up. What are the services and supports that are needed to make sure that that individual continues to feel safe. So with that, let's think about how do we connect with our COCs. So some of you are already doing this, but some of you maybe need to consider this for the first time. Some of you are maybe a little tired like me. You've been working through this pandemic. You've been staring at your screen a lot, and you've maybe gotten on autopilot with your COC a little bit. So if you've gotten on autopilot, my goal is to shake your cage a little bit today and make sure that you're not on autopilot. And if this is your first time kind of working with your COC, my goal today is make sure that you have what you need to start that work. So what are some things you can do? Attend your COC's membership meetings. Most of the COCs, these are listed right on their website. The dates, the times, the Zoom link, you can get there pretty easy. If not, we can help make sure that you know how to get connected. This includes local regional planning committee meetings within the balance of state. Ask to be added to your COC's listserv so you can get their emails and know what's going on in the homeless system in your community. Invite people from your COC to school events. Let them know about what's going on at the school and what types of services and supports your school offers so they can share that with their folks. And then, of course, explore their websites and get to know some of the resources. You might be wondering, who's my person? Who's my COC person? Can I just have one person that I can contact? So every COC has a COC director. Some directors are in interim time right now. They're just sort of a placeholder as new leadership is identified, and some have been the directors for a long period of time. So Franklin County in particular is in a little bit of a transition with their COC lead. So it was told to us that it would be best to reach out to Steve. For the balance of state, you can reach out to Erica. In Cuyahoga, you can reach out to Melissa, and so on and so forth. And in these slides, you can literally click on these names and it will give you their email. So you can literally email them directly out of these slides so you know exactly who your contact person is. I'm going to skip through a couple of these because I want to talk here for a second. I want to ask Aubrey and Karen to talk a little bit about how it's working in your communities with schools and the COC and what benefits you see and how you've maybe supported schools in the coordinated entry process. Let's start with Aubrey and then we'll go to Karen. So I'm going to kick it over to you, Aubrey.
Thank you, Lisa. So definitely, I think a lot of our work with schools has been about coordination. We have, so with the YHDP funding that we got in this community 3 years ago, we established a project called Coordinated Entry and Rapid Resolution, AKA the CAR team, CARR, through HUD House. And so they are kind of like our front door for youth homelessness. So I've done a lot of work with the local school districts to coordinate with them. Luckily, HUD House has had the YOP Shop Youth Outreach Project for a very long time and has coordinated with schools and school counselors for a very long time. So we kind of already had that established benefit. The addition of having projects and funding for youth homelessness has just kind of added to almost like an extension of services we can offer young people and students. The biggest piece for our local schools that we've had to do is really just recognition of youth homelessness and recognizing what services are available, which pathways, and navigation. Navigation is a big piece, I feel like, of all of the work is where do people go, like based on regulations. I have a lot of regulations in my system. And so if you're couch surfing, if you're in between systems, if you're in child welfare, if you're in juvenile justice systems, how do we navigate all of these systems to help the young person? That's been a large part of our work and really is still a large part of our work, but that's where we are today. So we have this coordinated access and rapid resolution team. And when youth aren't quote unquote eligible for services through YHDP, then we really talk about those at a system level to decide what is this youth and who do they represent and how do we coordinate with other services to support all of the young people that are both at risk of homelessness and experiencing homelessness.
Awesome. That was great. Karen, why don't you go right ahead? And I already see some questions coming in. So if you have some specific questions for Karen and Aubrey as they're talking, feel free to throw those in the chat. And Karen, talk to us about some of the benefits of partnering with schools and what this is looking like in your COC up in Cuyahoga.
Got it. So in Cuyahoga County, in the Cleveland schools, we have Project ACT. And so that is a great resource for them to connect with us and us to connect with them. So if we get a call into the hotline and it's someone that's attending a Cleveland school, then we'll make sure everybody's on the same page and explore like what all the different options are. I mean, the biggest thing that I feel like everyone is like so quick to respond, you know, like I'll hear, oh, she got into, like I had a call last week at one of the schools. She got kicked out. Her mom kicked her out. She just turned, 18 yesterday. Okay, well, so instead of like running with it and just really embracing the kid, making sure that we have a family systems model because we know that these kids aren't going to make it by themselves and they have to have permanent connections. So, you know, it was really important that we had mom come up to school too. And, you know, she also wanted, you know, the student wanted her dad to be called as well. So, you know, we turned it into a whole family system intervention. And we were able to stabilize her actually at grandma's for a little while until we can have her learn some life skills through another program that we referred her to. And then from there, she's going to launch. So we work very closely with our school. So we have a 24/7 hotline, and then someone calls and says, you know, I'm working with this student and he's just not feeling safe, especially around the holidays. Like maybe somebody's coming home that they have prior victimization from, or maybe mom relapsed, maybe mom's not taking her medication. We see a lot of unstable adults and kids with mental health issues right now, because, you know, they'll say like, oh, well, it was the pandemic, so she never went back to her psychiatrist. So there's a lot of psychiatry crises that we can resolve without going to the emergency room. So Cleveland just opened up this really cool, I think it's called the diversion program, but you know, if someone's 18 and over, they can go in there and voluntarily stay for, I think it's like 20 days. And so they can get reassessed for their medication. It's really helpful for someone that's like schizophrenic. So, I mean, as far as our continuum of care, we are very active with subcommittees as well as our monthly meetings, making sure to keep giving kids, young adults a voice at all the tables, right? Because some people say like young adults, they really mean youth, and vice versa. So, you know, we're really clear that we go up to age 21, but, you know, we have seen 12-year-olds. We probably have a dozen 12-year-olds that are missing, that are out on the street. And so we are really concerned because we have a big increase. I mean, I think the pandemic and poverty has really made it really difficult as far as poverty and gang involvement. And we've lost these kids to the street, some of them. And you know, these kids are also have warrants for their arrest and they're 12. So, you know, as many kids as we can wrap services around, and that's the benefit of the COC, is that like it gives us this strong collaboration of people that we can call. I think one of the other slides will talk a little bit more, but I mean, the thing with homeless and missing youth is that you have to have a number that you can call after 5 o'clock. Right? Because everybody will say like, oh yeah, I'll be glad to help. And then at 5:30, nobody's available. So, you know, having really good resources that you can really use. So you're not, you know, we had a kid actually from a school a few weeks ago, and it was awesome. She had some cognitive delays and she didn't know where she lived or her mom's phone number because her mom took her phone. So we were at the police department and trying to get her back home. She was like so overwhelmed, and it was great because the police officer knew the security guard's number from the school. And he was like, I know it's after hours, but is there any way you could access this kid's address? Because she has no idea where she lives. So, you know, he didn't have that resource and have the security guard's cell phone number, I'd probably still be sitting there with her. So, you know, and if not, I was going to have to call county. So like, really, I have to bring her into this system just because she didn't have that information. So, I don't know, I was going to look at the questions.
Yeah, though that's a great example too. I just want to uplift that example because we're talking about coordination at sort of all levels here, right? There's having a seat at the table and speaking about the way your whole community operates as a continuum of care to preventing and ending homelessness. But then there's also just that relationship building and that working together as partners on these specific individual issues, because we know every single experience of homelessness is individual. So the response is going to be individual too. Karen doesn't need to call that resource officer every single time she has a student from that school. But in this particular situation where the student didn't know their address, this was like a direct line to getting that information, to really doing that diversion that we're talking about and really preventing this unnecessary use of systems materials that we don't need, right? If we're able to get that young person reunified and work together to get that information and make that happen, then that's exactly what we want to do. So I think I'm curious to hear from others what you think about this partnership with your COC. What stands out to you as a benefit? What sounds good to you? What's something that you worry about or struggle with? And I'll just hush up for a second, see if anybody wants to come off mute and share a little bit about that. And if not, we'll just keep going and we'll discuss a couple other things and see if folks feel more comfortable as we go. But let's just kind of start there. We've covered a lot. What do we think about sort of that collaboration with the COC? Okay.
I'll just add, so I'm still learning, obviously. I didn't realize that we were connected to a greater COC. I just thought that was, part of what we did in our county. And I know they do it in Ross County as well. So I'm like amazed that all of this is out there, and looking forward to connecting with others on the COC. So I mean, it's great. I love going to the meetings. I wish they were more often, but I understand why they're not. But just to learn more that what other agencies are doing and get together and communicate and learn how we can help each other at the same time. So I just think the meetings are great. And now I just feel like so much better because there's more out there that, I haven't taken advantage of. So I'm very excited about that.
Yeah, definitely appreciate that reflection, Dawn. Yeah, give me 1 second, Shannon, I'll kick it over to you. I just wanted to say, if you're feeling that state, like I know that feeling of like, we're only meeting quarterly or we're only meeting monthly and my list just keeps getting longer, we need to have more conversations. One of the things you can throw out there to your COC is the concept of having a youth-specific committee and what that would look like, and having subcommittees from your main committee to focus on key goals and you report back out to that bigger group. So I just wanted to respond to that real quick, Dawn, and then I want to hear from others. Please go ahead, Sharon.
Thank you. I just wanted to add that our coordination with our COC is pretty solid as far as the services that exist in our area. And Akron, believe it or not, as big as we are, we're just missing a service provider for youth who is willing to provide the types of things that you guys are talking about, or that we want to connect them to, a youth specific shelter program or host homes or something that is specific to youth. We've got a couple of agencies who do similar stuff, but just are not willing to say like, hey, I will be that youth emergency housing coordinator provider. And we even have a youth specific COC committee that we attend, with the lack of somebody saying, yes, I'll apply for the youth action grant, or yes, I will, be the person that you can send a kid who doesn't have housing to. And so that's here in Akron. I feel like we've got that coordination, just that lack of a service provider.
Sorry, I lost my mouse for a second. I was trying to find my mouse so I can mute. I think that's a really good observation, right? Well, like we're all at different stages of collaborating with our COC. So there are definitely times when it's like, yeah, we all are kind of on the same page, but no, it doesn't feel like anyone's necessarily taking leadership of some of the most pressing issues. So like, who's the big toe in this group? And we know with young people in particular, providers tend to see liability and costs, and that high liability is a concern, and those high costs and inability to sustain responses is a concern. And so we're going to cover some things today about how we're showing up at the table to see if some of those ways we can adjust the way we show up might help with folks taking leadership and how we can be solution oriented in our approach. I do think, just from the work that I've been doing with folks in Summit County, there is new energy in Summit County around youth homelessness and some added capacity around youth homelessness in Akron in particular. So I do see some really good things on the horizon for Akron. I know you have a long time provider there who's probably very specialized in certain things, but you may need a wider variety of resources to meet everyone's needs. So I do know Summit County Health Department in particular is really trying to take the lead on some of that work. So I think if you're not already connected with Vanessa and Shalita, you probably already are if you're on that committee, but if not, I'd love to support you in having some of those conversations and what it looks like to have that leadership. And like I said, I definitely have just seen in the past year a huge kind of turn in Summit County for more focus on this. I think your COC leadership really sees this as a priority. So I think continuing to pound that drum of what your needs are and continuing to use your data to back that up is how you're going to see the changes that you want to see, and how you start to stand up the supports that you're looking for in your community. So I definitely appreciate you sharing that, because I know that it looks different in every community, and trying to identify your gaps. And then once they are identified, trying to live with the fact that they haven't been patched up can be really difficult. So I think just continuing to work through what the data is and continuing to tell the story, and then even more using lived experience and youth voice to really bring that message home is going to be critical to getting that work done in your community in Akron in particular. So I think one of the things I wanted to touch on today is, again, kind of how we show up at the table. And so there's this really wonderful podcast by an international expert on human trafficking, Dr. Celia Williamson. You might be familiar with her from out of Toledo. She runs the Human Trafficking Institute. She has this really amazing podcast called Emancipation Nation. And these effective agreements of collaboration come from her. So these are her words and her work. And I think that she really understands, and human trafficking, just like homelessness, is such a multi-system issue, how critical it is to have all the partners at the table. And so she really has identified some of these agreements of collaboration. So how we show up at the table, agreeing not to be competitive, agreeing to be fully present. So not on your phone, not coming in and out of the meetings, not every single time there's a meeting having a crisis. Of course, there are emergencies and you may need to step out of a meeting from time to time, but showing up as the person who infamously jumps on their phone within 5 minutes of the meeting starting is not how you want to show up as an engaged collaborator. Sorry, what happened there? I lost my, there we go. Agreeing, oh, I'm sorry, guys. Here we go. Slides are going crazy. There we go. Agreeing to be at the table for the right reason. So you're not there to advance your career. You're not there simply because your boss sent you. You don't have a hidden agenda. You're there because you were bought in on the mission and you do believe that you have shared goals. You agree to come to the table to use the time in a productive way. You support keeping the balance between process and accomplishment. If you find yourself in one of those meetings and every time you show up, all we're ever talking about is the process and we're never getting anything done, then you want to be the person at that table that's like, when are we going to take some action? We've been talking and talking and talking. It's time to do some testing, right? So we need to show up in that way. Agreeing to listen, not just hear, but listen with an open spirit. The way you disagree with people, the people in the room, says a lot more about you than it does with them. So make sure you're disagreeing with dignity and respect. Agreeing to learn. We don't have all the answers. We need to learn where people in the room are coming from. We have to suspend judgment. We have to be willing to consider perspectives and approaches. And you want that mindset of being a resource. You want to appreciate the way everybody shows up at the table, and you want to agree to learn the language instead of my way and the way my district does it, or no other way. It's more about learning who the people are at the table and why they're there, what's their motives, what's their agenda, and being able to work through that So when you do have a need, you can frame that up in a way that it's checking the boxes for them. They're making that connection between what you're asking for and how it affects them. Agreeing to value. So agreeing to value, again, what others bring to the table. Understanding their motivations, right? What makes them buy in on something versus what makes you buy in on something. Also being curious, but with dignity, right? If you feel like a particular partner is not honoring their procedures or policies or being inconsistent, working to understand what their policies and procedures are is a really good starting place so that you can better understand where the pitfalls are and where the blind spots are. Never be afraid to ask questions and asking what people need. So these are the kind of ways that we start to kind of build that road with intention, and we start to show up with a collaborator mindset. So what are the effects of agreeing to these commitments? You are a collaborator with integrity who is mission driven, not just someone with your own agenda that's specific to your district, but you're about your community and you're showing up for the overall mission. You value what partners say. New partners start to come to the table for the right reasons because you come to the table for the right reasons. Partners will not want to waste time because you lead with a mindset is time is of the essence, right? You don't approach the work on autopilot and silos start to be addressed. So I think, I just tried to kind of go through those sort of quickly, but I'm curious from Aubrey and Karen, when you notice the authenticity of a way a partner shows up and what your thoughts are about authentically showing up in the collaborator space. So Karen, maybe we'll start with you this time and then we'll go to Aubrey.
So I'm trying to think the best way to explain this. So, I mean, really, it's again, having those relationships and having those partnerships where, particularly in some of our missing youth, it could be that the person that has returned to school has shared with somebody that they might be being groomed or they might be trafficked. And so we're trying to make sure that everybody's really mindful and being non-judgmental and that we're really assessing their needs and safety at all times. So it might be then from there, we need to contact a legal guardian or a parent and get her to the emergency room to be seen by a sexual assault nurse examiner. I mean, so sometimes the process is, or the people and the supports we need can just grow really quickly depending on what the family situation is. Someone might come to school and say we've been staying in a hotel and nobody knew this. And she had left her books and someone of course said well, you can probably run and get them. Well, it's not that easy. The hotel that they're staying in is probably 30 minutes away possibly. So again, just helping people be present with these youth. And we're just always educating, this is really difficult, validating their feelings, and making sure that people have what they need, right? So I would say that a sad product that I've had to buy a lot of during COVID has been toilet paper and underwear for girls. So we go through a lot of toilet paper. So, when you just think about that, when I say to a kid, when I'm sitting with her at school, is there anything you need that would help you to be more successful, or you're going to be at grandma's for a little bit? Last week, at least 5 kids said, I could use some underwear, whether it's a girl or a boy. It takes a lot of pride to say that, you can be 13 years old and you're going to tell some lady that you just met that you need underwear. That's really hard. And so making sure that we have a lot of dignity, because these are horrible situations, right? I have been at Belfair for 34 years, so I have seen a lot, but as far as the effects of the poverty on our kids, it's really, really hard. They have so many barriers, and I just think we're all exposed to so much trauma, that what we need to do is make sure that we're working closely together and being present and holding each other accountable. So.
Yeah, thanks so much, Karen. I really appreciate that. And I really appreciate the way you're weaving in these real life examples. Aubrey's been through a lot with white CP planning and what it looks like for all these different people to try to sit around a table and make agreements. So Aubrey, share with us what it looks like to be an authentic collaborator and how you stand out when you're not, right? And just give us some feedback on that.
So I love Karen's example because my funding cannot pay for tampons, literally like cannot, even though that might be a need. And what I mean
I could mail you some. We have a ton.
What I mean by that is honestly, right? Like I'm a youth person that ended up at a system level. And what I'll tell you is like, I can only pay for what I can pay for. And even though I'm at a system level, I literally can see, right, the system gaps in funding for a holistic program that's going to serve young people, right? Like you and I, everybody in this audience knows what youth need. Like that's not the problem. The person in front of you, the young person in front of you, you know exactly what they need and what they need to get to their best next. I don't always have the funding for that, even though I get the need. And so when you're collaborating, one of the things that I would say is the pro tip is reach out, have connections. The personal connections that you have with young people are the same personal connections you need to have with the providers. Most of my providers have my cell phone. They know that they can pick up the phone and call me. Now they may not call me because they need money for tampons, but they will call me and say, hey, this is a gap in services and we don't have the funding. And I know good and well, I don't have the funding to pay for it, but let's figure it out together. Because the reality is that by collaborating with the local folks that are doing the work, we're going to be able to create the systems locally that are going to actually fill those gaps. A lot of times on a large scale, I'm never going to get like a federal mandate on, for example, reproductive, services and support and tampons, right? Like I'm not going to get that. So what I'm going to do is create a local infrastructure based on the relationships that I have. And at a system level, right? Like that's my goal. I'm not really doing direct service anymore. I'm always thinking about what are the systemic gaps that I can fill. And a lot of times those don't come to light without the collaboration of my providers. The literally picking up the phone and going, hey, Aubrey, this kid is falling through the gaps and here's why. And then I can go, oh, well, if that happens every single time, that's going to be a problem. That's going to be a gap. This person has fallen into a gap that will be a gap for everybody in this situation. Let's say, for example, youth involved in juvenile justice can't enter transitional housing units with, felony convictions pending. I'm just making this up, but like, let's say that that's a local barrier. Then with that one person, that in the relationship I have with that provider to say, hey, Aubrey, here, they're not fitting in. That's where I can then at a system level go, you know what, this is a system thing and we need to elevate that. And so I think really the pro tip I would say is that relationship is everything. You guys know that relationship with youth is everything. Relationship with providers is everything. I've been in this work for so long. I can tell you that I am so blessed to have local providers that I've been working with for years and years and years, no matter what position I had. And we've always had that same kind of like local, we're in this together kind of feel. And I would say that that's the thing that really is going to elevate your systems, is to have that collaboration locally, because some of these things you will be able to elevate to a system level that fills those gaps. Other things you will know at a system level, this is always a thing we need to treat individually. And so we always need to talk about it in this way. And you'll be able to then create also pathways that are individualized for the youth we serve. Because I'll give you an example, LGBTQIA youth, we always come across certain features, situations where I really can't handle it at a system level, but we want to then create a pathway at a local level that we talk about these. It's a normalized thing that we talk at an individual level. So I would just say, as far as local experts and collaborators, there's both this ability to elevate systemic change as well as create individualized pathways where we know that we always individualize for youth because of this, and this, right? So it really is both things that you can really elevate and really help young people that are experiencing homelessness.
Thanks so much, Aubrey and Karen, for that. You know, I think, Aubrey, one of my big takeaways from what you just shared there is not making assumptions, right? Maybe you've called and tried to get funds. We're using the tampon example a lot today. You've called and tried to get those funds from that provider. Aubrey can't pay for it. The last thing you want to do is say, Aubrey can't pay for it, I'm not even going to pick up the phone and call her. Because when we're talking about that systems change work, Aubrey, hearing that all the time, we can't pay for that, we need that, this is a need, that you can't ever stop doing that. We can't just make the assumption that because that provider doesn't do it in that way that we like, that we don't even bother to pick up the phone and call them anymore. We don't work with that provider anymore because we don't like the way that's done. That negates the fact that people change. It negates the fact that funding changes. It negates the fact that staff change. It negates the fact that training happens. It makes an assumption out the gate that this is a gap that's been here a long time and those people over there don't care about it. And that is not the way we approach systems collaboration, right? So that pro tip is just we don't make those assumptions, and we know that even though HUD funds might not be able to do it, the Continuum of Care has a responsibility to know about it. And your COC directors do want to know about it because they are tasked with building that quilt, that patchwork of resources to create these pathways for students and families experiencing homelessness. So we just cannot make those assumptions. So with that, let's do a quick time check. We're running low on time, but I'm going to start to wrap us up here. We're already sort of talking about what are these action items, right? Like, Lisa, please don't do the theoretical thing. Please tell me what I can actually do. I'm trying to work right now, right? Accepting that building cross-systems relationships is a foundation to intentional partnership. Operationalizing the sharing and analyzing of cross-system data for program planning and implementation. I was bringing this up with the Akron example for when we were talking earlier, right? Sometimes our messaging can be strengthened by that data-driven approach, right? Really showing up with the numbers that you have and knowing what those tell you about what's going on in your community. Identifying students experiencing homelessness across the systems, wrapping around, Karen talked about this a lot, wrapping around students identified as experiencing homelessness and putting those interventions in place, supporting students' educational goals towards this coordination, right? And this is where we start to kind of just get some organization. So engaging in the local coordinated entry process with the express purpose of developing a comprehensive youth-friendly and family-friendly approach to that work, participating in your point in time count, what your role can be in the point in time count and how that can really help you to better understand the homelessness needs and the numbers in your community, working with the pre-K providers and how they show up in the homeless space and what you can be thinking about in the child care space and the early ed space, and identifying, we've really kind of like danced around this, right? But like we need those flexible funding options. And what are those flexible funding options? How do we put together requests for them? How do we start to braid them into the resources that we already have? So these are the things we can start to look at. Here's another list of things your system can, or your district can start to do to collaborate right now. A couple key things, right? Including youth as partners in the work, having district staff on key committees that you regularly attend so you're aware of what's going on, ensuring that your services are safe and inviting, and just more things your district can do right now. So we've just given you a ton of options and examples of ways that you can start to put this work into action. And then, I want to kick us over to here. I'm curious I want to kind of get out of here on some of your closing thoughts from the group. So I'm kind of wondering, what are some key takeaways from today, and or what's something new your district can do this month or within the next 30 days to start increasing system coordination? What resources do you need? And if none of those are jumping out at you, maybe name a partner in the chat that you can connect with in the next 30 days. So anybody have any thoughts about how they can take some action on some of this coordination in the next couple of weeks?
I just had a quick idea that I was thinking about. Like, I'm not sure how many of you actually have had an experience with someone that has come to you and said, like, I need a bus pass. We're having some issues at home. I got to stay somewhere else, or, have really utilized the hotel voucher program through the McKinsey-Vento. So, I mean, that's something that we could look at in a different like group discussion, but like anything, it's always helpful to have like a drill, right? So like, okay, today we're going to like pretend like a kid's coming through, and who would respond? How would we respond? Do we pull in a specific security person to support this child? Is this child coming to us, but also says they have a warrant? So who can we talk to at juvenile court so we don't have to go down there? So, I mean, I'd be glad to like have another type of group discussion where we really walk through that. But, it's got to be hard, because I know all of you that are assigned as McKinsey-Vento liaisons have like 1,000 other responsibilities. So when the kid comes to you and says you need a bus pass, I'm not sure that you have like this big access of them. So those would just be things that we could talk more about. Like, I know, like, we work really closely with lots of the school districts, so they'll call and say, oh my God, Karen, please come over and bring like the backpack with like, hygiene kit, this kid needs clothes. And so we'll just respond. But I know that that's because we have a different grant, and many of you don't have that. So I'd be glad to problem solve that. And, I'm sure Lisa and everybody, we could look at that, but it would be really nice for people to really have a drill. So when a kid does present to you, people have a plan.
Absolutely. I mean, I know me and Karen are kind of cut from the same cloth in terms of outreach director people, and we love running drills. Like my team, it was like a weekly, we're going to run the drill. You're going to be the young person. I'm going to be the worker, switch, right? What's the scenario? How do we handle this? And that kind of stuff works because it starts to build up this predictability muscle, and we have more confidence, and we're more ready to face these challenges. And the same is, it's like what Aubrey said too, the same is true when we're working with young people as it is with partners. So sometimes we need to do those same strategies before we walk into a COC meeting. Sometimes we need to run those same drills before we walk into a youth committee meeting. So we're really grounded in like what we need to say and what our gaps are and how we need to feel heard. So I think that's a really good point to kind of leave us with today, is sometimes the best action we can take is practice, right? It's like the same thing we would tell anyone who's trying to get better at anything that they're doing, is to run those drills, do that practice, work on the language, begin to understand what those gaps are so that you can talk about them in a way that feels authentic and true and real. So we are at 2:29. I'm sure I'm not the only one that probably has to go pick up their kiddo from school, so I think we should start to bring this to a close. I do want to let folks know just really quickly, so you can kind of quickly see this on the screen. There's a ton of resources here for you. These are all clickable links, so definitely check those out. Websites for all your COCs, a whole bunch of resources on coordination to help support your work. So please, please, please check those out. They're already posted on the website. And hopefully we will see you in the big group Community of Practice on the 18th. And for more info, visit the website or send us an email. And everyone have a good rest of the day.